Senate Bill 562, which was the single-payer healthcare bill for California, was put to a halt in the Assembly. Now, the large story you've probably heard about this is that it was stopped by a corrupt politician, somebody who's been given money by the pharmaceutical industry and lobbyists for the healthcare industry that didn't want single-payer for the state, which, look, is probably true, but there's actually more to the story that isn't really being told. And I just want to give some context here to make you understand that in this case, it's not just corruption that is stopping this single-payer bill. There's actually more to it. California Assembly Speaker Anthony Rendon is the one that shelved the bill, so of course he's the one taking the most heat for this. So of course a lot of people took to Twitter and named Rendon, including Bernie Sanders and Our Revolution. And for the most part, the blame is warranted. Since the 2010 election, the 24 lawmakers on the 2 California legislative committees that will consider the single-payer legislation have collectively received more than $819,000 in donations from the industry groups that are officially opposing the measure. The Time also notes that House Speaker Anthony Rendon, Senate President Kevin DeLon, and Governor Jerry Brown, all Democrats, have also separately received a combined $370,000 from the groups. So on the face of it, it appears pretty cut and dry. The government officials that opposed the single-payer healthcare bill were also the ones that were being given donations from groups that also oppose single-payer healthcare. But the reality is, even if it did pass, nothing would have actually happened until at least 2018. So this is an article from The Intercept from David Dayen, and he breaks this down. So he makes the case that California single-payer organizers are actually deceiving their supporters by acting like this bill could have become law. They're perfectly aware that SB 562 is a shell bill that cannot become law without a ballot measure approved by voters. Rather than committing to raising the millions of dollars that would be needed to overcome special interests and pass the initiative, they would, apparently, rather deceive their supporters. Okay, so how are single-payer organizers deceiving their supporters? Well, first, I'm going to say I don't know if I completely agree with that line, but he makes his case here, and let me just break down what the real issue is. And the real issue is Proposition 98. Passed in 1988, Proposition 98 requires that roughly 40% of all general fund revenues, money the state receives in taxes, must go to K-12 education. If you include community college spending, it must exceed 50%. So if you double the state general fund by putting a single-payer system on budget, at least 40 to 50% of those new revenues have to go to education. Which means that as long as Prop 98 exists, you have to raise twice as much money than originally intended to support a single-payer healthcare plan. So if Prop 98 is the issue, then can't you just suspend it? Well, you can, with 2/3 of the legislature. But the suspension can last for only a single year. It would have to be renewed annually to keep single-payer going. More importantly, as the California Budget and Policy Center explains, after any suspension, the state must increase Prop 98 funding over time to the level that it would have reached absent the suspension. Meaning you can't just keep suspending it, because every year you suspend it, the funding just continues to grow and grow. And that gets to the real solution to get single-payer, which is a ballot measure. The only way to truly get it done is with a ballot measure that either overhauls Prop 98 or exempts single-payer from the formula. And ballot measures only happen during statewide elections in even-numbered years. If there was real interest in getting single-payer done, supporters wouldn't focus on a shell bill, but would start raising the gobs of money you'd need for the ballot measure, which will come under massive assault from every industry affected by shifting away from for-profit healthcare. So as you can see, it's a little more complicated than just one guy in the legislature being corrupted. It has a lot to do with the fact that there is no current way to fund a single-payer healthcare bill, and there can't be until 2018. But this is where I sort of differ from the perspective of this Intercept article. I don't see why you can't pass a single-payer healthcare bill now and then push for the ballot measure. Because to get people riled up and excited about pushing a ballot measure, don't you sort of need a reason? And having single-payer healthcare passed would be that motivation to then go out and really push for this ballot measure. That's why I say that at the heart of this is still corruption. Because if they wanted to, Rendon could have pushed for the single-payer bill and passed it, and then looked for the funding in terms of pushing a ballot measure down the line. But instead of doing it that way, they decided to shelve the bill now and not have any discussions about how to get the funding. So at the heart of this is still the fact that money influences politics. And for some reason, there is always this extra questioning when it comes to progressive policy, but when it's something that they want done, that the big money interests want done, they find a way to get it done.